She loves being a nurse, but she could not remain silent about what she saw happening to children. Welcome to Freedom Alive. Vanessa Sivadge is a registered nurse in Texas. Vanessa is the whistleblower in a May 2023 story with a doctor's testimony exposing the secret gender procedures happening at Texas Children's Hospital. Even though the procedures are illegal on children in Texas, this abuse and fraud has still been happening. Vanessa joins us to share more, including when the FBI showed up at her door and threatened her. Don't miss our interview with Vanessa Sivadge, but first, our Freedom Alert is next. The woke mind virus destroyed his son. In 2022, Tesla and SpaceX CEO Elon Musk lost his son. The billionaire's then 18-year-old son, Xavier, announced a female gender identity and name. Xavier even petitioned a California court so he could take his mother's last name. In a recent interview with Dr. Jordan Peterson, Musk explained how the woke mind virus of gender ideology figuratively killed his son. Musk said he was tricked into giving consent to put Xavier on puberty blockers. He admitted he didn't understand, but was told Xavier might commit suicide without them. Dr. Peterson said gender ideology has led to many demolished kids, and no reliable clinician has ever believed puberty blockers would prevent suicide. And any notion of suicide from doctors is a lie. We must speak the truth. Our children are at stake. I'm pleased to be joined by a very special guest, a courageous guest, actually, a registered nurse. Her name is Vanessa Sivadge, and she became known because of what's happening at Texas Children's Hospital with regards to their so-called gender clinic and some of the things that the Texas Children's Hospital officials were doing to children, parents, and trying to hide that from the public. Welcome to Freedom Alive, Vanessa.
Thank you for having me.
Vanessa, you're a registered nurse, and you also have been involved in doing some internships in Washington, D.C. I want to give a little bit of background to our viewers before we get into the amazing situation that you encountered, even including FBI agents coming to your door. And I want to build up what your background is before we get to some of the unfolding events at the Texas Children's Hospital. So you're a registered nurse. How did you choose the profession of nursing?
I grew up in Houston, Texas, which is regarded by many as the largest medical center in the world. And I had many opportunities during high school to volunteer at my local hospitals, to go to different Christian summer camps where I was also able to develop those skills. And eventually I just really grew to love the nursing profession and the one-on-one care that the opportunity afforded. And so I decided to pursue nursing here in Houston.
So now you get this job at Texas Children's Hospital. It's a very large teaching or hospital for children. I imagine that's a pretty exciting moment when you landed the job at Texas Children's Hospital.
It really was. It was a dream come true, truly. And I was so honored and so grateful to have started my career at essentially the best children's hospital in the United States. And for those who aren't aware, there's multiple hospitals in the Houston area and in Austin. There's over 25,000, 30,000 employees and growing. And it's just a really huge hospital system, and it's widely regarded as the best place to treat children. And so I started in the cardiology department. That was where I received the bulk of my training. And that is where I would see babies born with congenital heart defects. And we would see them and treat them, and they would have surgery, and we would essentially save their life. And so that's where I received the bulk of my training. But I contrasted that with my new role in the pediatric multi-specialty clinic, where we were seeing perfectly healthy children, and we were making them sick. We were making them medical patients for life. And so that was very much against everything I believed.
So on the one hand, you start off in the cardiology department. You got sick children that, but for the care that they would receive at Texas Children's Hospital, would possibly die or certainly have a very difficult life ahead of them. And then you get transferred to the multifaceted pediatrics section, where you have healthy children. They're coming in healthy. There's nothing wrong with their physical bodies. And now you're giving them cross-sex hormones, puberty blockers, and in some cases, mutilating surgeries to amputate healthy body parts. When you went into that particular location of the hospital, did you have any idea what you were getting ready to experience?
Absolutely not. This was in 2021, and I had completed an internship with the Family Research Council, as you said earlier, and I really believe that opportunity prepared me to really confront in love and with respect and with grace the situation that I would soon find myself in. And that is a pediatric gender clinic. And the provider I worked very closely with, Dr. Richard Roberts, who was seeing transgender patients. And I feel like I always have to qualify that, because I don't believe there is such a thing as a transgender patient. I believe in male and female. And I do believe that children can be confused by their sex, or perhaps even deceived. But I don't think that there is such a thing as a transgender patient. And so in the months that followed, I started becoming very familiar with this patient population, and eventually was asked to do things that I wasn't comfortable with, that went against my beliefs. I can remember one example where there was a teenage boy, and Dr. Roberts asked me to go into this patient's room and teach him how to administer an injection to himself. And this was not an uncommon request. Nurses often do patient teaching or education in a clinic. But what I realized after is that I had taught this patient how to administer an injection to himself, and that he was going to go home and inject estrogen to himself using what I had taught him, and to affirm the false identity that he had adopted for himself. He wanted to feminize his facial characteristics, his sexual characteristics. And it was a truly devastating realization that he was going to use what I taught him to affirm that false identity.
Yeah, so normally you would teach, say, somebody who's got diabetes, maybe to go ahead and do some injections at home, monitor their blood sugars. But you didn't realize when you were told to teach this person how to do the injections that this was a boy that was actually going to be injecting estrogen to try to placate this false narrative that maybe he could actually become a girl?
That's a great question. You know, it's important to kind of paint the picture, the context. Physicians will often ask nurses who are just sitting in the clinic to do a patient teaching that have no background or no knowledge on why they're doing the teaching. It's not, it's a very unstructured kind of environment where if a physician needs something, they will ask for the first available nurse to perform that. And so that's kind of how it happened in my situation. I didn't realize at the moment what was happening, but later I kind of put the pieces of the puzzle together and realized that this was a boy confused about his sex, and that he was going to go home and administer cross-sex hormones to himself.
Now, I know eventually the Governor Abbott and the Attorney General for Texas came out with a particular position statement that administering puberty blockers, cross-sex hormones, and performing these mutilating surgeries was child abuse. And then there was a situation with a doctor, Dr. Hyam, who was a medical resident there at TCH, who gave an anonymous whistleblower report of individuals redacting the data of the patients, showing what was actually happening at Texas Children's Hospital. Take us from that moment on when information became public. First of all, it was anonymous as it relates to who the whistleblower was. Take us from that moment on, and then what happened afterwards.
Exactly. So, during this time, I felt very helpless and very outnumbered because I knew for a fact that this was wrong. This was against my Judeo-Christian worldview. This was against the laws of basic biology and doing no harm as medical professionals. And so I felt very outnumbered in a massive hospital system. And so that's when, in March of 2022, Attorney General Ken Paxton here in Texas issued an opinion that providing gender-affirming care could constitute an investigation as child abuse. And so in order to shield themselves from that liability, the hospital then issued a statement unequivocally shutting down the gender medicine program at the hospital, saying that they were going to stop everything. And that was not true. The hospital lied. And so I knew that was a lie because I was working in that clinic that was providing those cross-sex hormones. And so in May of 2023, that's when an anonymous whistleblower, who we now know as Dr. Heim, came forward and worked with Christopher Rufo to expose the existence of this secret transgender program that was not even listed on the hospital website. The hospital had not made this available to the public or to lawmakers on purpose. And so this came out, and I read this piece, and I knew that I had to come forward to corroborate this whistleblower's testimony. So that's exactly what I did. I reached out to Christopher Rufo, the journalist, and then I came forward as a second anonymous whistleblower in May of 2023, and I just affirmed the testimony of Dr. Heim that this program did indeed exist, that the hospital had hidden it from the public, and that cross-sex hormones were being prescribed to minors.
Actually, when you came out, I believe you didn't know who the whistleblower was. Is that correct? You learned about the identity of the whistleblower later when he identified himself.
That's correct.
And then in the meantime, was it after or before you confirmed this anonymous, at the time, whistleblower's report, that this has been going on for a year or more after the Attorney General said that this was child abuse, after the hospital said they weren't going to do this anymore? Now you got a visit at your home. Tell us about what happened there.
Absolutely. So on July 24th of 2023, I had given my anonymous testimony. I felt like I had fulfilled, there was a sense of purpose with that. I knew that I had spoken the truth when I came forward. And so I thought that everything was perfectly fine. I was going about my work as best as I could. And July 24th, 2 months later, it was a Monday evening, and we're here at home with my husband, hosting friends, grilling burgers, and there is a knock on the front door. And my husband and I go to answer the door, and there are two federal agents who flash their badges, and they ask to speak with me about issues at my work. And we're absolutely stunned. They proceed to tell me that they are at my home because they know of my beliefs. They know that I'm opposed to transgender medicine. And they also inform me that I am a person of interest in an investigation targeting a whistleblower who has leaked classified patient information and violated HIPAA. And I knew that was a lie because I knew what they were referring to, which was the article that had come out previously exposing the existence of this program. But they were lying because there was absolutely no patient information that was visible. It had all been redacted. And I knew that they were there to try to intimidate me and to helping them expose this person who I had never met, and I had no idea who he was. But they wanted to recruit my help to expose his identity to the world. And they said that if I did not help them, that they could not protect me. They made me feel very threatened and said that I wasn't safe at my workplace, that someone had given them my name at my work, and that I was not safe.
So what happened then, you have the anonymous whistleblower, the doctor comes out with the article, Chris Rufo publishes it. You also are anonymous in speaking to the publication, affirming that what actually was presented is true because you've witnessed it. So your name's still not out there publicly at this point. Then you get the knock on the door by the FBI agents, and they say somebody at work gave your name to them because they know your beliefs in this issue. And they are now putting pressure on you as a person of interest, which is pretty intimidating, frankly, when you get visited by the FBI and you're a person of interest. That means maybe you're going to be indicted. You know, they're intimidating you. And that they also say that you're not safe at your work. I mean, how did you feel?
It was really a really scary experience. In the months that followed that visit, I remember having many conversations with my husband, and we were at a crossroads. You know, we had to make a decision of how we were going to react to this. And at first we didn't know what to do or what to think, or even if we needed legal counsel. There's no manual or rule book on what to do after something like this happens to you. And so this is where we just had to turn to the Lord, and we had to ask God for his wisdom and his grace in helping us navigate this like very uncharted territory for us. And there's a verse in Ephesians 5 that was very significant during this time. And it says to have nothing to do with the fruitless deeds of evil and darkness, but rather expose them. And so we knew that we could not allow the enemy to keep us in this place of fear and anxiety and confusion, but that we needed to combat that with what God has called us to do as believers and as ambassadors of a heavenly kingdom, that this world is not our home, that God defines what he designs, and that we are called to celebrate that and uphold that as true and as right and as beautiful for all the world to see. And that's regardless of the consequences.
I want to go on to a few other points here before we continue, but in your witnessing, I want to talk about the Medicare fraud, which I want you to address in a few minutes. But what did they do to the parents? How did they treat the parents? Some of the doctors there, because I've read some things about how the doctors would sort of mock the parents, or they would intimidate the parents that if you don't go along with us, we're going to report you as child abuse. If you don't affirm these children of the opposite sex gender that they want to be affirmed, then what you're doing is committing child abuse. Tell us about what you experienced or what you saw in that respect.
Absolutely. I believe that this particular segment or this particular category of medicine, endocrinology, which is where the transgender category of patients falls under endocrinology, it's truly been captured by people committed to this ideology. I believe that there are many, many good doctors and nurses still out there who hold a correct view of biology, but many of the providers in the endocrinology do not. And so what happens is during a patient visit, a child who is confused about their sex will voice that to the doctor, and the doctor notes in the visit which parents are affirming of the child's confused identity and which ones are not. And even more than that, the doctor goes through the cross-sex hormones and the so-called treatments for a confused gender identity. And at the very bottom, he or she says there is no contraindication to beginning testosterone. Mm-hmm. There is no contraindication to beginning estrogen, which is a lie. There's irreversible damage here for every child for the rest of their life, depending on how long they're on these hormones. And so some parents are affirming and very supportive, and those who are not are quickly, I believe, convinced into affirming the child's confused identity.
Also, you found that they were using some federal funds that would be banned in Texas to use for some of these medical interventions.
Absolutely. Under Texas Medicaid policy, Texas does not cover any form of gender-affirming care, cross-sex hormones, puberty blockers, anything relating to the diagnosis of gender dysphoria. They clearly state this is available online. They do not cover these treatments. And yet I was shocked to discover, as I was going about my everyday work, that these transgender patients, many of them have Medicaid listed as an insurance or CHIP or STAR or something similar. And that raised a lot of red flags for me when I started seeing that. In addition to that, the hospital has intentionally misdiagnosed patients for the purpose of justifying these cross-sex hormones. So an example of that would be you have a healthy teenage boy who's confused about his sex, and the doctor will say that he has an estrogen deficiency as the official diagnosis, which is a lie because there is no such thing as a male having an estrogen deficiency. And so this then justifies the doctor prescribing estrogen for this boy. And that is really egregious. And when I realized that this is being billed to American taxpayers without them knowing about it, I knew I had to say something.
Vanessa, thank you for standing up. I know it's not been easy. It's not easy to be visited by the FBI. It's not easy to be under the microscope. It's not easy to be investigated, even by your own employer at Texas Children's Hospital. And what your future holds, only God knows. But I want you to talk to the viewers, both in the medical profession and outside of the medical profession, why it's important to be able to speak up. You didn't come picking a fight. You were very excited about being in this position where God put you to treat and help children. And yet when you were put in this position, you stood on principle and you faced a lot of headwinds as a result of it. Tell us in terms of what your thoughts are, what your heart says to the people watching, and particularly those in the medical profession.
I think that if we are going to follow the science as medical professionals, as nurses, that has to mean something. And the science is undeniable, and it says that men and women are intrinsically different. From the smallest cell in our DNA to our bone structure to our reproductive anatomy. We are created by God with those differences, and those differences are to be upheld and celebrated. Doesn't matter how many hormones or surgeries a person undergoes, will never be able to change what God has created us to be. And so I believe also that do no harm has to mean something, and that this is a very black and white issue. This is a foundational Genesis 1 issue that believers in Christ must be compelled to speak the truth about, regardless of the consequences or what is deemed culturally acceptable or not. Truth is not about what the majority believes. It is not about what is politically correct, because God defines what is true, and that is unchanging. So the passage in Ephesians 5, I take that very literally, have nothing to do with the worthless deeds of evil and darkness, but instead expose them. And I know exactly what it's like to be in a hospital system that is very hostile to your beliefs, very hostile to your views. I empathize with those people who are in that situation, but I believe that the benefits far outweigh the risks to speaking out what has been done that's illegal, what's been done that's behind closed doors, and what's been done that's in secret. I believe that the benefits far outweigh those risks.
Well, Vanessa, you are an example of courage and an inspiration to so many of us. May God bless you. The prayers of many are with you. And what has been intended against you for evil, God will turn around to good. It may not be very apparent now, but I can tell you, doing the right thing as you are doing, God will bless your courage and your commitment to truth and righteousness. So God bless you. We will put up a website so that you can help support Vanessa in her continued battle. Thank you for joining us on Freedom Alive.
Thank you.
What an amazing story of courage, and what a sad situation that we see happening at Texas Children's Hospital. But that hospital is not the only place that this is occurring. Thank God that you had a doctor who reported this information, and that you had a nurse, Vanessa, our guest, who had the courage to be able to speak up on this issue, even though it cost her her job. She has now been fired by the Texas Children's Hospital for doing what nurses should do: care for patients, care for children in this case, and expose fraud. This hospital has been alleged to actually engage in Medicaid and Medicare fraud by actually using those funds, which are prohibited under Texas law, for treatments such as puberty blockers that will sterilize children, cross-sex hormones that they'll have to take for the rest of their lives, and even performing mutilating surgeries. And one of the amazing things that Vanessa said as we talked with her is that the doctors were very cavalier about the parents. They would pressure them into going down this road, saying that, in fact, if they didn't adhere to the advice that they were given by the doctors, that their children would commit suicide, or that they were committing child abuse, when in fact the hospital itself was committing child abuse. She said that she was in a very dark place, and that she believed in Ephesians that this was spiritual warfare. Indeed, it was, when the FBI showed up at her door with the sole intent of silencing her. It's amazing. I've had a chance to see the doorbell view of that particular arrival of the FBI agents. How intimidating is that when you're there with your family, friends, and the FBI shows up and indicates that your life might be in danger, and that you are possibly a target of investigation by the United States government for doing what? For doing the right thing. This hospital engaged in shameful acts, but I am very thankful that Vanessa has given an example of encouragement, and I hope that this show and her statements, her discussion of what she experienced, encourages you and many others. For those of you who are in hospitals across the country, you see what Vanessa sees. You know what's going on in those hospitals. There are some watching this program right now, and you know exactly what some of these hospitals are doing. Whether it's in violation of their state law or not, this is wrong, and you know it. I encourage you to come out and speak up like Vanessa. Don't walk away. Don't seek a transfer. Speak up, because the lives of these children are at stake. Well, in closing, remember Galatians 5, verse 1, which says, "It was for freedom that Christ has set us free. Therefore, keep standing firm and do not be subject again to a yoke of slavery." Our freedom is a gift from our Creator. We must never forget that and always protect it. So join us here next time, where you will hear victories as well as ways you can stand up for your priceless freedom. Join us again for Freedom Alive.